This is the 100th episode of the Low Back Pain Podcast with RehabFix Low Back Program. And we're going to do something special today. If you've been listening to this, that means you've been riding with me for a while now. And what we would like to offer is a free assessment to one of you who is listening. This assessment will be an hour long, where we will meet with you. We will go over your situation. We will take you through movements, tests, and ranges of motion to establish your restrictions. We will take you through exercises so we can start to identify the exercises you should be doing and you should not be doing. And then we will even retest these movements during this call so we can assess for improvement. On average, most of our clients get around 30% improvement just during this initial call. And we're going to offer it to one of you who is listening right now for free. And here's all you need to do, okay? If you're listening to this over the next 24 hours, email our account, my main account, grant@therehabfix.com. Again, that is grant@therehabfix.com. Put 100 in the subject line, okay? Title the email 100. And then in the main email body, I want you to tell me two things. One, where are you from? Two, what would your number one goal be with our help? What would you like to accomplish with your current situation? What would you like to get out of, or what would you like to get back to doing? Let us know what your number one goal is. My team is going to go through these emails. We're going to select one that stands out to us. We're going to shoot you back an email, and you will have a free assessment with us for us to go through your situation and to ideally provide you some answers. This is best for someone who has been previously diagnosed with a disc herniation or has sciatica. We get the best results with our sciatica clients. And especially if you're someone who notices that the longer you sit, the more you feel it, bending forward to put socks and shoes on in the morning, or it's stiff standing up straight after sitting long periods. If these are the types of things that you are experiencing, then you are especially in this group of individuals that we see pretty fast results with. So I'm excited to see whoever wins this, and I'm excited to provide you with some answers towards your situation so we can help someone out there in need, because this is what we do. We love helping people resolve their back pain. So go ahead and complete that email, and let's get to the rest of the show. Hello and welcome to episode 100 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix Online Low Back Program. Today's topic is top 3 reasons to not have spine surgery. This is a big one that will provide a lot of information for many of you out there who might be considering surgery or who have friends that are considering surgery, and why you might not want to make that jump, and maybe some instances where you should make that decision. We will discuss both sides of the coin today. Of course, if you have not joined my private Facebook group, RehabFix Low Back Program, yet, you absolutely should, because upon joining, you will be immediately tagged in our free step-by-step sciatica guide that we use to help thousands of people around the world recover from back pain and sciatica issues, and you can get access to it for free just by joining, and you will get to immerse yourself in a community of people who actually care and are invested in their success, and you will get one-on-one connection with myself. So go join RehabFix Low Back Program on Facebook. Now let's get right into it, okay? The first reason why you might not want to have surgery is a simple one. Many of you might know this, but just bear with me, okay? Is that surgery is not permanent. There are a vast majority of people who actually believe that surgery is a permanent solution to whatever they might be feeling. The social opinion of surgery, is specifically spine surgery, on disc herniations or nerves, are that something needs to be cut out. And if you just cut that out, if you just cut that disc out, if you just, burn that nerve off, then you're done. It's fixed. A lot of people tend to view the body as a car. Oh, well, when a part wears out, you just got to get a new part. That is not true. The body is way more complex than a car, and parts don't just necessarily wear out on a body because we have the ability to regenerate tissue and the ability to adapt to load. So that example does not apply. But a lot of people might just say, oh, well, let's just keep it simple here. I'm not a car guy, okay? Let's just say, oh, you got a bad tire. The other tires look fine, but this tire, you just got to replace that tire. Okay, well, what if the reason that one tire is bad is because of the way that you drive or the pattern in which you drive on your daily commute or whatever, or the attention that you pay to that particular tire? Maybe that's the reason that tire gets worn out. So you simply throw a new tire in that spot, and then guess what? Oh my gosh, that one tire is wearing out again. Oh, we'll just throw another tire on there. So as you can see, my analogy here is surgery is the equivalent to slapping a new tire on there. It isn't permanent if you're not changing what you are doing in your life that is creating the need for that surgery in the first place. Please do not hear what I am not saying. I am not saying that surgery is never needed. There are always unique circumstances where something out there that exists is needed in the right context. But the point is that the vast majority of surgeries are not needed. The vast majorities of surgeries are not a permanent solution. And the vast majority of people believe that it is. That is the problem. So unless you're actually changing the function of your body, your beliefs, your education, your strength, your mobility, and your movement-based habits, you will not have a permanent solution in surgery. It will not be permanent. Number 2, if someone does proceed with surgery, the rate of needing an additional surgery after that is high. In fact, most reherniations occur within the first 6 weeks after a disc herniation related surgery. So many people then require additional surgeries, whether in a short period after surgery or within a matter of 2 to 3 years, because once again, that tire on your car, you never actually changed the way you drive or the way you maintain your car. So that will give way again. Now, one particular additional influence here is when you replace a tire on your car, it doesn't necessarily put your car at a mechanical disadvantage. However, when you have surgery on a disc, it actually does provide a mechanical disadvantage in that area of the disc. It is more likely to herniate or re-injure in that same place again because of the surgery and because you did not actually address the problem with your strength, your movement, your habits, etc. So requiring an additional surgery is a legitimate concern that surgeries might take you down. And around 20 to 30% of individuals that receive a lumbar surgery will be told that they need another one. And the rate of success goes down the more surgeries you have. This is well documented. Failed low back surgery syndrome is a well documented phenomenon. And in some instances, upwards of 40% of low back surgeries might fail. So anything that is going to require you to continue to do it, potentially, once again, there are unique circumstances where it is successful, depending on what that situation entails. But for, once again, we are speaking to the vast majority, a additional surgery is a realistic outcome and necessity for many people. Well, I should not say a necessity. I should say is a realistic outcome based on the medical advice that you're being provided. Oh, we did a surgery. Oh, it didn't help. Well, we just need another one. And then as you get more and more, you will eventually be pushed to do a fusion. You will be pushed to do a fusion if you continue to have microdiscectomy surgeries, because once you have taken so much and, impacted that area enough, they're going to say, well, we've removed a lot. We just need to fuse that area now to prevent it from moving. That will be the next step if you continue down the surgery route. And lastly, the risk of complications. So as with anything, there are complications. There are side effects to everything, right? For surgeries, I believe the percentage is around 20% of low back surgeries will have complications. Now, some of these complications range from as simple as a wound infection that might be extremely minor to as serious as death or paralysis, right? But there's a 20% complication rate. If you were to look at the statistics for the complication rate of physical therapy or chiropractic care or any sort of manual or physical medicine based intervention, I mean, what would we be looking at? 1%, 2%, something incredibly negligible. But 20% complication rate for surgery is quite significant when you're taking into account the invasiveness of that intervention. Some of the top surgeons out there will openly be proud of their statistics. Most of them, we call it the 1/3. A good surgeon will be proud of the fact that they have 1/3 of their patients are successful with surgery, at least in the short-term period. 1/3 of them will be the same after surgery, so no different. And then 1/3 will be worse after surgery. That is a kind of general good statistic for most surgeons. Of course, I'm speaking to the vast majority. I'm sure there are some surgeons out there who are very, very evidence-based, that are very, very particular about who they work with. They probably only work with someone who they know for sure will do the right rehab after that surgery to improve the rates of their own interventions, right? Surgeons want to have good rates, and there are some out there who are amazing. But this is the general approach. This is the most common approach. Right, that's what I'm speaking to. So one additional point we might bring up is the fact that if those top surgeons, or if anyone is thinking in their head, hey, after I do surgery, then I'll do my rehab. I know I need to do rehab. Everyone knows they should do rehab after surgery. If you are needing to do rehab and physical therapy anyway, then just do that from the start. Just do it from the start. And I know many people will say, oh, I already tried physical therapy. Trying physical therapy is a very general term. Trying rehab is a general term. Trying chiropractic is a general term. Really what you're saying is, I tried one person. Trying one physical therapist does not mean you tried physical therapy. Trying one chiropractor does not mean you tried chiropractic. You are generalizing what you receive from that individual. 1,000 physical therapists could provide 1,000 different forms of rehab. 1,000 chiropractors could provide 1,000 different forms of chiropractic related treatment, whatever that is. That could be physical therapy. Okay. So if you know you're going to need to do that anyway, just try it from the start. Just try it from the start and pursue it until you actually know for sure if you are in that very rare group that actually needs surgery. And I've made additional podcasts on red flags, on when to see a neurosurgeon, on how to truly know if you're in that surgical category. Okay. And some of these red flags I will bring up, and you should go listen to our podcast on when to see a neurosurgeon. But just to say it real quickly, significant motor or neurological deficits. If your big toe is going numb, and then all your toes are numb, and now your entire foot is numb, and now your lower leg is numb, and that continues to progress, even after pursuing rehab, even after having an injection or an oral steroid, then most likely you're heading towards that point of needing a surgery. Or motor deficits. Your foot gets weak, it's difficult to lift it up, or if it's difficult to do a calf raise, and that gets worse and worse, and your lower leg is getting weaker and weaker after doing physical therapy, after doing rehab, after seeing a chiropractor, after doing an injection and medication. If you get to that point, then you might be in that boat. But there's a lot of time that you have to try many things before jumping to the most significant procedure that exists for back-related issues. We have tons of clients who hurt their back one day. Within the first week, they go to see their general provider. They get referred for an MRI. There's a herniation. They get referred to an orthopedist, and they're being scheduled for surgery the next week. It happens all of the time. All of the time. And that is a terrible way to go about medicine. It is a terrible way to go through a clinical evaluation of the individual in front of you. But it happens every day. So we can proudly say we have probably canceled around 500 low back surgeries at this point. We're very proud of saying that. We've had many clients who have already tried low back surgery, who regressed, who came to us because they wanted to avoid a second one, because they know the second they get sucked into that second one, the spiral of chronic pain can truly begin. And we've been able to help these individuals too, who've already had a failed low back surgery. So we wear this as a badge of honor, and we would like to cancel 10,000 more surgeries. So I hope that this podcast was insightful for maybe why we shouldn't do this, but also maybe some pointers on when you might consider that. But I have many additional podcasts on that. And ultimately, you just need to get with the right person and get with the right plan before you would know for sure. You want to exhaust all of your options anyway, so do everything you can before you come to that conclusion. And we would love to have the opportunity to help you. So if you're listening to this and you feel like you might be in this boat, then visit the link in the description of this video, of this podcast. Click on the link, learn about our system. You can schedule an appointment with us. We'll take you through it, okay? Or go to our website, submit an application. But definitely join our Facebook group and get involved and learn more about what you could possibly do for yourself and for your situation, because you can get better, but you need to believe that you can get better, and you need to take action on getting better. Those are requirements in order for you to do so. So I look forward to seeing you soon. I look forward to seeing you in our private Facebook group, RehabFix Low Back Program, and seeing that you truly are serious and motivated to do something about your situation so that we can help you potentially avoid a surgery. If you are watching this on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and help reach more individuals who deserve to get results, who feel like they're spinning their tires and getting frustrated in doing so. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.